Well, there's a new option for Hoosiers who think they may have been previously infected with COVID-19. Kroger Health will soon launch rapid antibody testing at its chain of pharmacies, expanding in-clinic and at-home COVID-19 diagnostic tests. Cincinnati-based Kroger will be the first retailer in the U.S. to offer rapid antibody testing to customers. The 15-minute finger prick test looks for antibodies that show the person was previously infected with the virus that causes COVID-19. And Business of Health reporter Kylie Valletta is here with more. Kylie.
Thanks, Gary. Kroger says Hoosiers will be able to get the antibody test at any Kroger in Indiana around the end of November. Another interesting piece of this is the low cost of the test, only $25. Earlier, antibody tests offered to the public had to be sent to a lab and were much more expensive. Tammy Sarmiento is the regional clinical director in Indianapolis for Kroger Health, and she joins me now to tell us more about the tests coming soon to Indiana. Tammy, thanks for being on the show today.
My pleasure. Thank you for having me.
Well, as we mentioned, Kroger's the first U.S. retailer to have these rapid antibody tests. Why did Kroger want to make these inexpensive tests so widely available?
Absolutely. So throughout the pandemic, Kroger and Kroger Health has remained committed to helping our communities live healthier lives and to help simplify healthcare by bringing at-home COVID testing as well as in-clinic testing for those individuals. And now we've added the rapid antibody testing to that scope of service in all of our little clinics inside select Krogers. And we'll be rolling that out to all of our Kroger and Kroger family of pharmacies by the end of November.
And this test really is for anyone, even if they're just curious if they've had COVID-19. But it's also important to mention it's not 100% accurate. So what are some of the disclaimers, so to speak, that we need to know with this test?
Sure, absolutely. So this test is set up so back when this pandemic started, as you recall, many of us had an illness that no one could really explain. The flu test was negative, but we were, pretty sick at times. And so for those individuals who think, man, I am almost positive I've had COVID, this is the test for them. So this test would, a positive result would indicate that the patient or the individual has had COVID in the past and their body has formed some sort of immune antibody in response to that. If the test is negative, on the other hand, that would indicate they have not been infected prior with COVID, and or that they may be in that life cycle of the virus where it's still in the acute stage and the body hasn't developed antibodies to COVID at that point. So it takes the body about 1 to 3 weeks to build antibodies. And so the timing of that test, so someone who is asymptomatic and they're getting the test, but could possibly still be infected currently with the virus, that's where that disclaimer comes in there. The test that we're using that is brought to us by AssureTech, research has shown that it's 98% accurate and just as good, if not better and reliable than that you would have sent out to a lab.
Okay, and I know scientists, of course, are saying we still don't know if you have 100% immunity once you have had COVID-19.
Absolutely.
Okay, so it is a quick and simple test. We've been showing some video of it. Just a finger prick. It almost looks like a blood sugar test, like it's just loaded into a cartridge. Can you tell us the process?
Absolutely. So the individual will come into the clinic and our licensed healthcare professionals will clean the fingertip using a lancet, much like that used for a blood sugar check. Prick the finger, a very small amount of blood is then put into a cassette, and it takes about 15 minutes to run that test. So from start to finish, 15 to 20 minutes, and an individual could know if they've had antibodies or had COVID-19 in the past.
Okay, and we do want to make sure folks know once this test is available, you will have to make an appointment to be tested. Available at the end of November. What are you expecting response to be like?
So we have had right now in our little clinics throughout Indiana and across the country, we've had a significant interest and demand in individuals in the community seeking the rapid antibody testing. We anticipate that that is going to increase in demand and interest as we roll that out to all of our Kroger and family of pharmacies throughout central Indiana.
Okay, in just a few seconds left, Tammy, but I know you're also excited about rapid COVID testing coming soon.
Yes.
Can you give us the quick snippet on that?
Absolutely. So Kroger Health, again, will be rolling out a rapid antigen test that will be done point of care. So what that means is you will, it's similar to the PCR test that's offered now across the country, but this will be a rapid test. You will know your results within 15 to 20 minutes. Again, it is offered will be offered by the end of November in all of our little clinics across the state and across the nation, and all of our pharmacies. We're anticipating the rollout after the first of the year.
Okay, Tammy, sounds like you've been busy. Thanks for being on the show today and telling us more about it. Appreciate it.
Yes. Thank you so much.
Gary, back to you.
All right, Kylie, thank you.